Taiwan's mental health has seen better days, and COVID-19 is a big reason why. In the latest survey by the Mental Health Foundation conducted this fall, almost 30% of respondents said the pandemic has made them more depressed or anxious. That's despite the fact that life in Taiwan has been relatively normal in the past 3 years compared to other parts of the world. The foundation's head, Hu Haiguo, explains.
The people, they still have a high proportion of them have a problem in their business. The store has to be closed. And also the guest, the customer decreased a lot. So their business becomes slow a lot. And in that condition, about 30% of the general population, they encounter the economic problems. So, and also they do not have a good outlook in the near future.
Overall, the foundation says the state of Taiwan's mental health is acceptable. But what about that 30% of people? What can they do if they need help? How good is Taiwan's mental health care system? And are people willing to use it?
So the system here for the mental health care is, I would say, it's a satisfactory condition. But the problem is that the people, they do not know at what stage they need to see the psychiatrist. So the system is good, it's well functioning. But the people, I would say, many people, they are feel resistant to see psychiatrists, or they do not know that they can get help from the psychiatrist or the psychologist.
Has Taiwan seen similar dips in mental health in past years? It seems yes, and in a predictable cycle, once every 4 years.
So for the coming to the president election year, people getting anxious, getting more the different opinion, and they have some sort of more argument, and the society becoming more uneasy. So every time at the president election, the mental health index score is becoming lower.
So what does the foundation think can be done to help Taiwan's mental health recover as we leave the pandemic behind?
For the government, I would say that there are significant people that have some sort of economic problem. So the government must pay attention to those more, I would say, they are hardworking people. Their income decreased markedly. So the government might pay attention for those people with economic problems.
But there are things people experiencing depression and anxiety can do for themselves. The foundation recommends exercise, time in nature, and human interaction. But it also encourages people not to hesitate to seek out mental health care professionals when they need to. Lien and John Van Trieste for TaiwanPlus.